Over the last 10 years, the Department of Radiology at the University of Florida College of Medicine has conducted a simulation-based evaluation of radiology resident competence in critical care imaging. 321 residents interpreted this case of sacral fracture as one of 65 cases during an 8-hour simulated on-call shift with a median score of 0 out of 10 and overall average score of 1.29 out of 10. On average, 8.71 points out of 10 were lost due to missed observations. At the same time, 0 points were lost due to interpretive errors. We define an effective report to be one which achieves scores between 7 and 10. In terms of letter grades, this would be A and B. In this most missed case, 6% of residents produced effective reports. We define a report having a critical error to be one with scores between 0 and 2. In terms of letter grades, this would be F and D. In this most missed case, 80% of residents produced reports with critical errors.
Frontal view of the pelvis and frog leg lateral views of both hips in a 40-year-old woman with atypical low back pain after a recent fall demonstrate subtle irregularity of the first foraminal line or arcuate line of the left sacrum. This is suspicious for a sacral fracture. The sacroiliac joints and pubic symphysis are not widened. No additional fractures are identified. This finding should be given an acuity ranking of urgent, and further evaluation with CT is recommended. This finding should be communicated directly to the referring provider. It can be very difficult to detect sacral fractures on radiographs. We get a projection image of fairly complex three-dimensional anatomy. Furthermore, bowel contents often obscure the sacrum to some extent, as in this case. That being said, we should be assessing the sacral foraminal or arcuate lines on every pelvic radiograph. These foraminal lines reflect the superior margin of the ventral sacral foramina. Any asymmetry is suspicious for fracture and raises concern for pelvic ring injury. Hence, we should be assessing for other signs of pelvic ring injury when we detect this foraminal irregularity, including widening of the sacroiliac joints or pubic symphysis. We should also take a close look at the obturator rings for fractures. I routinely recommend CT in these cases to better characterize whether the sacral fracture involves the foramina or spinal canal and to further assess for pelvic ring injury.